We're doing an invention. It's priority.
The only way to do great work is to love what you do.
Live life as though everything is rigged in your favor.
Ignore the noise. Have faith in yourself. Recognize that you are an entrepreneur.
From the campus of the University of Maryland's Robert H. Smith School of Business, the Dingman Center for Entrepreneurship presents Bootstrapped.
Welcome to the 5th season of Bootstrapped, a Dingman Center podcast. I'm Ilana Fine.
And I'm Joe Bailey.
And as all our listeners know, each episode of Bootstrapped features a founder from the Dingman Center and University of Maryland community. Today we have the CEO and founder of ReciproCare, Charlene Brown, in studio. Welcome.
Thank you.
So, Charlene, I think that you might be one of the most qualified bootstrap guests we've ever had.
Arguably, Charlene is overqualified.
Overqualified. An undergraduate degree from Princeton in chemical engineering, master's in public health, and an MD from Harvard Medical School. So, my first question is just if you could talk to us about your time practicing medicine. What was that like?
That's a great question. So I have two medical specialties. One is internal medicine, which is a clinical specialty. And then the second specialty that I'm board certified in is public health and general preventive medicine. And that is a specialty that thinks about populations as patients. So I did public health work in the U.S., in low and middle income countries around the world. And that led me to think of my patient as like a city or a community or a population, or in the case of ReciproCare, a workforce. So my career has really been about solving sort of chunky social problems that affect your ability to have good health outcomes and coming up with multifaceted ways to improve those outcomes.
I got to imagine most people would feel overwhelmed by trying to tackle those problems. Why are you so excited, and how do you have that kind of enthusiasm and ambition to go ahead and do that, to solve those difficult problems?
I've been excited about public health since I was 16. So my first job in high school was in the NYU Medical School biostatistics and epidemiology lab, and that was...
I worked at a pizza place. I'm just saying. I'm just in high school. I just want to be...
You weren't doing epidemiology at 16?
I know.
Come on,
Yeah. Okay, so the NYU, say that again, your high school internship was at...
It was...
Then we talk about, when I answer, I don't have to ask for the unfair advantage now. Okay, high school internship, epidemiology, NYU.
NYU Medical School.
NYU Medical School,
But I was doing data entry. It wasn't like I was an epidemiologist, but it exposed me to...
I was doing data entry at the pizza place, too. That makes it
It's all the same thing. Look,
it's all the same thing.
Charlene is fixing the problem. You're causing the problem. All those pizzas that people are eating.
Sorry, Charlene.
Unless you were entering, I'm going to give them the veggies. That's much better for
Okay,
you.
Charlene. All seriousness. Okay. Back to you.
It's totally fine. I love public health. So I went to college knowing that I wanted to combine medicine and public health. I even majored in chemical engineering, still knowing I wanted to do public health and medicine. After college, I did a fellowship through Princeton at the University of the West Indies, where I was they were doing this nationwide diabetes surveillance study. It's always a part of my sort of rubric to really care about solving problems for groups of people, in addition to solving individual problems. But when I had to make a choice at some point about whether or not I wanted to maintain both my public health identity and my clinical identity. Okay. And I made the choice to focus on my public health identity because while I love clinical medicine, I really love public health.
So you were practicing public health. Was that when you were at USAID? Was it at that point where you made that decision, or later on?
Actually earlier.
Okay.
And so, my first job was a fellowship. I moved to DC, like so many people, to do a policy fellowship. And that was how I got placed at USAID through this AAA, American Association for the Advancement of Science, has a Science and Technology Public Policy Fellowship. So I came to DC to do this fellowship. I was fortunate enough to have a placement at USAID in the newly formed Office of HIV and AIDS. And that was a really transformative experience for me. So that was my first opportunity to do public health like full time, as opposed to the many projects I've been doing on the side throughout my training and my education. So I worked at USAID. Then after my 2-year fellowship, I formed a small consulting company and did sort of consulting for different companies that did global health work. And then I started the rest of my career. I went back to USAID 5 years later. So I focused on domestic health for 5 years, and then I moved back to USAID.
And as you're kind of going through this progression, you're changing on what public health issue is important to you? I mean, or are you interested in all public health? Because diabetes, HIV, AIDS, I imagine today we talking about opioid epidemic or something. How do you pick which public health issues?
I love it all. At some point, I figured out that the most interesting jobs were at the top, were senior positions, because that way you could work on multiple issues at the same time.
Yeah.
And so when I was at the Baltimore City Health Department, I was hired as an assistant commissioner for clinical services. So I oversaw all of the health department clinics and sort of HIV and sexually transmitted disease outreach. So I loved that role because it was so diverse. There were so many different issues, and building strategy and overseeing implementation for that was amazing. And then my role expanded as there was turnover in the department. And so I was promoted to deputy commissioner. And I was like, now I can do chronic disease prevention and cancer. I just love it.
And so clearly your path diverged because you're here on this podcast, which doesn't typically feature public health professionals, but features entrepreneurs. So talk about how your entrepreneurial story began.
Absolutely. So I can say this, that I'm still a public health professional in the context of my business.
Yes.
But it began many years ago when I was still working at USAID, and I had reached a point where I had done so many little businesses on the side. I really felt like I was this entrepreneur in the just, I don't know how to describe it. Like I was an entrepreneur, but not being an entrepreneur. So I lived this life where I had this blue turquoise notebook that my husband had purchased for me because I was constantly spouting off these business ideas as we walked through life. And he's like, just write them down. I think he was tired of hearing them. And eventually I had a friend who was a serial entrepreneur, and I went up to him and I said, just teach me. And he did. We sat in his living room with this huge whiteboard, and he taught me about like the business model canvas, what is lean startup, how do you really think about your ideas, all of these ideas I was having. And he really helped me to realize that a lot of my ideas were nonprofits, not businesses. What is the business model became sort of a core element of how I started to think about the many things I was interested in. And he also taught me about understanding pain, like what a pain point is, as opposed to just an interesting problem to solve. And so when I came to the problem that ReciproCare is solving, I was able to immediately recognize as an excruciating pain point and knew that I really wanted to work on it.
Was the ReciproCare idea kind of born out of those living room sessions with the whiteboard and the business model canvas?
No, it happened later, actually. I was working on I had wanted to create this peer matching platform for patients with life-changing illness for social support, which is a nonprofit idea in hindsight. But I wanted to participate in the Startup Weekend. I was still working full-time, so I wanted to do a Startup Weekend. And when I went to Startup Weekend with a friend of mine who became my original co-founder, we went, and then they said, you can't talk about the idea. You can't talk about something you're working on. You have to present something new. And so I pitched a precursor idea to ReciproCare and formed a team. And we were able to spend that weekend really fleshing out sort of that idea and talking to stakeholders and discovering pain. I was like, oh my gosh, there's so much pain here. And we ended up winning that weekend, and that was very motivating. And so I felt like I needed to figure out what this thing that we had come across, where I really discovered how much caregivers, so like caregivers being home health aides, nursing assistants and so on, were really struggling with finding work. So talk to us
about that pain. What were you more specifically, what had you discovered by the end of that weekend?
I discovered that the home care marketplace is broken, and that despite this really massive demand for senior care as the baby boomer generation ages, that the workforce that's in such high demand was really struggling to find enough work to actually be working full time, which didn't make sense because there's a national shortage. So there was inconsistency. It had all the elements of like a problem, like a big chunky social problem where you have this huge societal need, an insufficient workforce to meet that need, and then the workforce itself was inefficiently used. And I felt like as an outsider to like not delivering care, that there would be ways that we could come up with to help bridge some of those gaps.
And just so our listeners understand, in this space, you're talking about kind of a person who needs home health care. You have somebody who wants to provide home health care, but how do they find each other and how do they match?
A little bit different because I keep talking about public health. Like because I have done public health, I really like to fix systems, and I wanted to actually support the existing infrastructure that's there for delivering senior care. So there are home care agencies, assisted living facilities, skilled nursing facilities. I didn't want to build a system where individual families could go onto our platform and find caregivers. I wanted to make it easier for the companies that were already delivering that care and that were struggling so much and turning away clients to be able to find those caregivers that they needed to hire to deliver that care. I felt like that's a much bigger, like 75% of, at least at the time, the data I saw showed that 75% of home care was being delivered through agencies. And 25% was sort of individual families finding their own caregiver.
And so just to clarify what you're saying, you were saying that, look, rather than, because we see so much kind of democratization of everything, like I want everything's DIY, I can do this myself. What you were saying is actually that's not the solution here. Yes, the technology, you could create the technology to make it where I just do it on my own, but you're saying, look, the agencies in the system that are in place, they can actually deliver that healthcare better if they have a better tool. Let's fix that part versus just putting it all in the hands of the individual consumer, because that's still suboptimal, you thought?
I believe that everything is needed.
Okay.
And so it's not a judgment on the other approach. It's basically saying this is where I believe I can have the biggest impact on the most people.
Yeah.
And so there's an entire industry. It's regulated by the government. It is the delivery of care to people in homes and facilities. And because I'm a health professional, I believe in the framework that supports like making sure there's quality care delivered, making sure that there's reliable care delivered. Like I wanted to make that work better as opposed to disrupting it. And there's so many startups that have already, we're already building a B2C model for home care. Also, a B2C model doesn't work for facility care, so it would also narrow my market. My market is across the entire, actually, I say senior care industry, but it's actually the entire healthcare industry and beyond. If I focus just on delivering caregivers to families, it's a much smaller part of the overall market that I wanted to tackle.
And you're then building with ReciproCare then a platform for all parts of the system?
I'm building a platform that can serve all parts of the system.
Can serve all parts of the system. So it's not targeted at a B2C. It could be B2B. It could be reaching beyond kind of the nearest neighbor within the value chain to go ahead and get help and coordinate activities. Is that right?
It's strictly B2B.
Oh, it's strictly B2B.
Strictly
okay.
B2B. So all this, it's B2B. Any entity, any kind of company that hires caregivers, that hires this frontline direct care workforce, could be served by ReciproCare. Right now, my focus is still home care because that's where the biggest pain is and the greatest need. But I eventually plan to expand to other
So give me an example of kind of a home care service that's going to be connecting using ReciproCare.
I could talk about our very first customer.
Sure, that'd be great. Yeah, let's talk about that.
The way that they use the platform is they essentially they created a profile, they post jobs. What I've done is I've built a marketplace of caregivers that it makes it easier and faster for them to find the right talent at the right time for the clients that they serve. And so what ReciproCare does is we collect more information about caregivers than almost any other site, and we require it before a caregiver can actually apply for a job. So that makes it, it enables that initial touch point with the caregiver to be much higher value. So caregivers are low income workforce. They have variable levels of digital literacy. And often a caregiver might respond to an ad on Craigslist with something as simple as, "Hi, my name is Sarah. I'm a CNA. Here's my phone number." So as a recruiter, Sarah might be the best caregiver you ever hired. The brevity of her response and the absence of her resume isn't a proxy for the quality of care she'll deliver. And so what we do is we standardize and make it easy for the agency to understand that Sarah has a CNA. It expires in July 2020. Her CPR is up to date. She lives here, is willing to work there, and has a car. The agency doesn't have to go through those extra hoops and can make faster decisions about who they want to interview and hire.
So just to kind of rewind a little bit, so one of the reasons that, so I think Charlene and I have known each other now for at least 2 or 3 years. I think we've met yes, maybe even more. I think met at a Connectpreneur event, met you through the, you're in the Halcyon Incubator. And one of the things that I think I met you at a time when my own family was, had needed to have some caregivers for both my grandparents and my mother-in-law. And I remember it really resonated with what you had talked to me about, is that there's often such a mismatch between what is needed and either the caregivers, like you're saying, experience, but also their schedule. And so how often that there's just not a good fit from the start. And we were experiencing that significantly on our end. So it really resonated with me that it wasn't necessarily because the person wasn't a good caregiver, but they either needed more money or need more hours or lived too far. And so it was just this constant revolving door of caregivers at a time when you have a lot of stress already and, somebody in poor health. And so talk to us on this. So you're saying on the recruitment side, you're helping to standardize almost like a common app like you would have for colleges. So everybody's kind of gets more of a fair playing field on input. And then what about for the actual agency? What are they doing?
So the agencies that have the most success with ReciproCare find a way to use that common app and not have the caregiver fill out a second application. One thing I didn't anticipate were interoperability issues with applicant tracking systems. I didn't actually, when I did my customer research, that just literally never came up, and I was like, oh my gosh, there's a problem. And so but there are workarounds, and over time we will be able to find ways to be able to port our data into the existing systems. But the companies that use our existing application, that downloaded it and uploaded it into their system, have a lot of success, because one of the ways that I believe we can draw more caregivers is through the promise of a common app. Caregivers spend so much time applying for jobs. There was a survey recently by a company that showed that at any point in time, 65% of caregivers working in home care are looking for a new job, and that 95% are receptive to the idea of a new job. And so there's this constant attention to job opportunities. And so when you're applying for jobs, that often a common app becomes very attractive. And we found that the idea of a common app came out of all of the research that we did with caregivers and the pain points that they were describing in their job search. And people don't always realize that there are actual barriers to job search for caregivers. And the common app is meant to alleviate some of the challenges that they have. And that in itself is a draw for caregivers to come to our platform.
And imagine that there's got to be metrics that measure the amount of churn that's going on where you're placed with a particular caregiver and it's not a good fit. And clearly the better the fit is and the less churn there is in this marketplace. And I'm sure I'm not using the right terms, but that's kind of the measurement for success of how good a match is you're making here.
So again, we are supporting the agencies and the facilities that are hiring caregivers, and they're making the match to the families. And so I want to prove that ReciproCare caregivers recruited through ReciproCare stay longer. But we're too
got
new
it.
to
Okay, so the duration then of how long the caregiver spends there is a way to go ahead and measure success.
It's a way to measure one type of success, but there are many other measures of success that are earlier in the chain than that.
And so you're saying what you're doing now is helping them on the supply side of the caregivers, and so they have more information about the caregivers than they had before, and then your value to the caregivers themselves is that they can have this common app that they might be sending to multiple agencies.
Yes.
Is that okay?
The challenge is, though, once we launched, we found that I couldn't promise the common app because I couldn't actually.
Because you had to integrate with every different caregiver. Okay, so that's the idea.
So do you also have a technology background? Did you do all the interoperability testing?
I wish. Oh my goodness.
Do you have a technology team with you?
I have a lead developer who works for us part-time, and I'm about to bring on a full-time developer. But if I can put out a wish list over
Yeah,
the
sure.
podcast.
Yes.
ReciproCare is always looking for a savvy, experienced technologist with experience in Ruby on Rails that would like to become sort of a core part of our team, potentially as a co-founder, to really take over product and really help us to move forward. I spend about 40% of my time on product still, and I feel like we could move faster and be more efficient if I were able to focus on more CEO things.
Yeah. And so tell me about where are you with the company now? So how many customers do you have, or basically either agencies or the caregivers, whatever metrics that matter the most to you? How are things going?
Well, I'd say that I learned some really valuable lessons. Things are going well, but maybe not in the typical way. So two-sided marketplaces are hard. And we came out of the gate racing, right?
Yeah.
We're like, okay, I'm going to get customers. You go get caregivers. We're going to do it. And we found that we were imbalanced, right? I have more demand than caregivers to supply. And I wasn't targeted enough in terms of geography. And so, for instance, Carroll County is very rural. It's very hard to find caregivers in Carroll County. And so I found that the lessons we learned were about being way more focused in terms of the geographies that we target, even within Maryland. And then making sure that we're adding like extreme value to those companies. So I reached a point where I had about 12 customers, but then I actually have enabled the ones in the areas that I'm no longer going to focus on to use the platform for free while I go deeper in Baltimore City, Baltimore County, PG County, Montgomery County, Howard County, and DC. Like that's going to be our focus right now. Because
you need to be able to say to those agencies that you can find enough caregivers that are going to be in close proximity.
Exactly. And the customer that, like, our very first customer has had, because we have a deep pool in Baltimore, she has had so much success that she is literally discontinuing her HR assistant resigned and she's not replacing her. She says that ReciproCare meets much of her needs. And I was trying.
Wait a minute! I'm supposed to be a workforce development company.
And no, it's actually.
Yeah, I'm kidding.
It's what it taught me was that we were. It showed me the value of what we were providing. Actually, I was like, oh, we're underpriced.
Good for you.
When ReciproCare works, it really works.
So, what is your pricing model?
I'd rather not say because it would be on record, and I'm still actually testing out different prices with different customers.
Or I guess
it's a subscription-based model. What I've quoted in the past is a range between $299 and $999 per month per site.
Okay.
But it's going to have to vary based upon geography. So, for example, balancing these two sides of the market is different, as you said, in Carroll County versus it is in, let's say, Baltimore County.
Exactly. And so it's more expensive to find caregivers in Carroll County than it is in Baltimore County. And those are some of the lessons that we've been learning.
And so, I mean, we teased you a little bit, but it's really just out of envy. But about, obviously, a part of your unfair advantage is how well you know the health system, your passion for the problem. I'm sure a lot of connections. How have you leveraged that to build this business?
So back when I was still working full-time at USAID, I joined the Maryland National Capital Home Care Association, which is the regional home care association. I started showing up at meetings. And it was they're very welcoming. I got my very first advisor, who is now the executive director of that association. She has more than 20 years of industry experience and really sat with me week after week after week in the beginning, really helping to shape this idea. So the entree that I get because I'm a doctor is pretty remarkable. I think even though I'm targeting nursing specialties, I get a lot of advantage based on curiosity. What are you?
Right, yeah.
What are you doing, doc? And then I also get. I think I just have a credibility that just comes with my experience, and I'm very grateful for that in doing this work. I find that I've had a really positive experience with the professional associations in the area that focus on senior care, whether it's Lifespan or MNCA, the Maryland National Capital Home Care Association. And yeah, I've been really, really lucky on that front.
I want to go back to a story that you told just now about the way in which kind of ReciproCare is being used to potentially even change the composition of the workforce there. Right. So one of the things that Alana and I teach our students is to focus on how many kind of customers kind of are loyal to you and how much they kind of use your product and give you feedback. It sounds like you have incredibly loyal customers.
I have been amazed that even when our marketplace was imbalanced and I wasn't delivering caregivers, I still had people saying, "But I love the product. You're gonna figure it out, Charlene. It's okay." They were so encouraging. So yeah, extremely loyal customers, even when they shouldn't have been. And so, and again, right now I'm actually going to be building out the case studies that show the impact of what we've done with our earliest customers.
And how important is that feedback and loyal customers to the future success and pivot points going forward?
I think my initial customers will forever be like the ones that made ReciproCare possible. Through their faith and trust in a first-time entrepreneur trying to solve a very big, chunky problem, and second, just through the transparency and openness that they've expressed in terms of sharing what's working and what's not. We've gotten so much feedback on the usability of the platform, on like the design, on functionality from the employers that we've worked with. It's been phenomenal. Yeah.
And so you talked a lot about building up. You had to balance building both sides of this market because you can't do both. And we talked about this. I remember we were interviewing Lise Wang from Snob Swap, who has kind of in a very, very different market, but thinking about how you get the consumers on as well as the consignment shops. And it's always that balance. And you're always doing both. Mm-hmm. But so how have you, it sounds like you know where to find the agencies. How do you find the caregivers? Like how are they hearing about you?
This is a great question. And I'll just be very transparent about how things went. We started the year with a very transactional approach, right? So we got very busy. We launched and we're like, okay, we're going to market on the job boards. We're going to do Google ads. We did all of this digital marketing and we combined it with some in-person events. So we went to job fairs, we hosted events. But that, like in the midst of doing that, we lost we didn't focus on what I believe was our core differentiator and our core mission, which is that we care about caregivers and that we're doing this from a very caregiver-centric way. The way that Amazon sees the customers always, right? Like we see the caregiver as our primary beneficiary in solving their problems is how we solve the problems of our paying customers. And so, but we got so busy that we weren't really engaging with them. We were just like, here's a job. Apply for a job. Did you apply for the job? Finish your profile. Do that. Right. Like it was all very transactional. And that was a mistake because again, that's what everybody does. And so what we moving forward are doing now is really focusing on building a pool of the most engaged caregivers in the nation. So we want our number one source for caregivers to be referral from other caregivers. And I believe that is how we're going to win in this marketplace, is really through word of mouth being the number one channel as opposed to what it is right now. It's our number 3 channel, but I want it to be our number 1 channel.
So talk to me about some of the next moves. I mean, there's lots of other geographies that have this problem as well. I mean, you clearly have international experience. The people who you're providing services to, they have other needs as well. What's next?
What's next is I am having the discipline to focus on what I believe is product market fit. So I had to face, in the midst of all of this racing, and this notion, there are these artificial timelines that are out there about how startups are supposed to grow at what rate over what time frame. And I was caught up in that. And I realized that I actually decided to focus on ensuring that I have proper, true product market fit in this geography so that I can replicate it in a real way moving forward. I see the path to how startups fail. I could have just kept racing. But now we're actually taking a step back. We're doing a couple of things I'm really excited about. So first, we're redesigning the user experience for caregivers. They have low digital literacy. We believe that the platform we built is one of the most usable that exists for caregivers, but there were friction points. And so we're taking those lessons and redesigning the experience for caregivers. We're bringing on another developer so that we can move faster with our product. and we're really focusing in on our engagement strategy for caregivers.
Well, I'll leave you the last question, though, because I think that's really important point that you brought up about really understanding your product fit before you move. How do you define product market fit?
Ooh, that's a good question.
All right, I got to keep my job.
I define product market fit as, like, should I just paint the beautiful rosy world that will exist when I have it?
Yeah, when you have it, what will it look like when you have it?
I will have a more liquid marketplace. And so the lesson, I couldn't possibly have imagined how challenging a two-sided marketplace was. Everybody said, oh, they're so hard. I was like, that's okay. I have We're dealing with a real pain point.
Right.
I got it.
If you
Don't
build
worry.
it, they will come. Yeah.
Harvard MD, everybody, right here, baby.
Hey, I mean, we did so much. I spent like a year doing research, literally a year. And so the pain points are real, but the science of, there's actual marketplace science. I've been reading all these articles. There are books. I need advisors with depth of marketplace experience, because I believe that the future product market fit is when we're able to grow our customer base and turn on the growth of our caregivers to match the customers, so that we're able to reliably deliver enough variety of caregivers to meet the needs. Like, for instance, I have a customer right now who posted a job very recently, and he's had 29 applicants, right? Like, that sounds like a lot, right?
Hey.
Like, surely 29 applicants. But he's like, I need more, right? I need more. And so we'll give him more. But like, in order to support one hire, that my customers actually want more candidates than I imagined they would need in the beginning. And so I think product market fit is when we have this nice balance between caregiver growth and customer growth, and both are growing fast.
Yeah. That's great. It's a great. I mean, it's that I think
and
we say
good revenue
and good revenue
yes.
match, right? I know we say it just. I mean, we say that all the time, and I think that I mean, I know Ed Barrientos on the episode about Brazen talked a lot about the product market fit, and we talk about this a lot in class. Product market fit not being binary, but just on the spectrum, that you're just slowly moving at a percentage to product market fit, that you might at some point be, you might have thought you were 100% there, but you're really kind of 20% or whatever number you would say. So anyway, well, Charlene, I thank you so much for being in studio with us today.
Absolutely.
And I look forward to continuing to watch your progress on solving this chunky problem, like
Thank
you
you,
said.
Charlene.
Thank you. It's a pleasure.
Really enjoyed learning from Charlene and her startup on ReciproCare about a kind of an interesting play on a two-sided market. We've had other two-sided markets on Bootstrapped before, including Vitus Vet and Snagaslip. But this one specifically is tied at that B2B portion of the chain. And frankly, it took me a while to kind of wrap my head around it, so I apologize to our listeners. But once I did, I kind of saw the way in which there's unique challenges in a two-sided market in that B2B space. Alana, did you think it was different as well?
I did. I mean, I think that that's one of, as Charlene talked about, I think that's one of the challenges that she's had in even telling her story, and it has evolved, is that I think people are automatically thinking, oh, this is care.com, or this is one of the other matching, staffing matching platforms. And that's not really at all what it is. It's really that, she talked about at the end, it's really the caregiver she's focusing on, and building that supply of those caregivers so that they can have so they are actually more utilized.
Yeah, and it sounds like, collectively, all those caregivers have a lot of pain points, and by kind of pooling kind of their applications and be able to go ahead and kind of be that pipeline of talent then for the agencies that are trying to place them, it does address that pain point. And it's so wonderful when Charlene talks about her kind of call to service here in public health and stuff like that, how it's such a driving force. And you could just see how it affects kind of her ability to think kind of as a visionary for her startup.
Yeah, and I think selfishly, when we've all been in the position of needing a caregiver, whether it's for someone aging or in ailing health or your kids, you think about you. That's all. You're solving that problem. Right. She's thinking about the caregiver and how far they're driving and how much money they're making and how many different locations they might be working to fill out their schedule. And so I think that's what most of us probably do take a while to understand it, because we're used to thinking about us as the people needing the care.
Right, and she is focusing on their value proposition or their side of the marketplace, and I think by designing kind of that application and kind of what the preferences are, could do a much better job of not only matching, but having kind of, what you described as her metric, kind of that tenure, how long somebody goes ahead and stays engaged in a particular type of caregiving relationship.
One of the things that I thought was interesting is how she talked about even some of the clients that were no longer using her basically said to her, like, we'll use you as much as we can, or when you figure this out, or when you get it right, or she said it in some way. And I think she clearly has found, she really has found her early adopters, and now she has to, and you could tell that we talk about early adopters as the people who are really willing to use the minimal viable product. Like, they'll use whatever you can give them that solves the most acute problem. And so it sounds like she has figured out who they are, and now is just trying to get the market's balance so that she can serve both of them. So, but it was interesting to hear her talk about people saying, look, please continue to solve this problem because it is real, but I need you to be able to give me enough caregivers for me to be able to use your platform.
Yeah, and the idea of kind of balancing two sides of the market is kind of obvious once the company has reached kind of astronomical levels. So Uber, for example, can go ahead in different geographic markets and put more advertising kind of on the consumer end of the market or on the driver end of the market, depending upon how much it's out of balance. And frankly, if it varies a little bit, there's such scale that it may not matter so much. In a startup phase, you have to go ahead and get that balance right in order to go ahead and kind of grow, as she kind of described, in sync. So let's say there's got to be 10 caregivers for every agency that exists, and that 10-to-1 ratio has got to kind of maintain as it kind of grows. And if it's out of whack the way it is in some of the counties in Maryland, as Charlene described, then it's going to be very difficult to go ahead and kind of keep that revenue coming in from subscriptions.
One thing I wanted to also, just the last thing I want to comment on is something she said about the timeline for startups. And I do think, and I think I'm probably guilty of it and of doing this, is that we are, those of us who work in the startup community often do put these like timelines or expectations on startups that, oh, well, once you raise your seed round, and then you should be, that should last you 18 months, and then you should be raising VC round. And that makes it, as Charlene was referring, really hard for the companies because they feel like they're being compared against like another, let's say, another athlete or something. Oh, well, you can sprint this fast. Why, they can sprint this fast. Why can't you? And hopefully as our listeners see from 44, 45 episodes, each one of these companies is so different that it's really unfair to apply that kind of timeline. And you can see it makes it really tough for the entrepreneurs.
Well, I mean, if you think about the platforms in the space, in a B2C kind of platform space, maybe people's expectations are wrong. Maybe they expect things to move much more quickly. But as we learned from another Bootstrapped episode, right, Sunny Bajaj was telling us in the federal space, it doesn't move that quickly, right? And you've got to be in it for the long game. And I have no doubt that Charlene is in it for the long game.
Yeah, absolutely. Well, another great episode. It was great to have Charlene in studio. Once again, thank you to all our listeners. This has been Bootstrapped, a Dingman Center podcast. I'm Ilana Fine. You can follow me at Ilana Fine or the Dingman Center at UMD_Dingman.
And you can follow me at Joseph P. Bailey. Thank you to all of our loyal listeners for downloading this episode and for subscribing to our podcast. Shout out to Podcast Village, who host us all the time for our great episodes. And, of course, our entrepreneur in residence here, Oscar Zabayos. Thank you, Oscar.
Thank you.
Until next time, everybody, we hope that you bootstrap your next venture.